Welcome to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a primary care physician and owner of In Touch Primary Care based in Sugar Land, Texas. And I am so excited you're here. This is a place to be if you desire to or are motivated to take charge of your health and make sure you're doing all you can to live a healthy lifestyle. Remember, you can always listen to this episode and all our episodes on the In Touch Primary Care YouTube channel. You can leave comments, subscribe, and share. All right. So today we're going to be talking about how you can, with lifestyle changes, really make improvements to your health and prevent many serious health conditions. And to start, I want to read an excerpt from Just As I Am. It's a book by Cecilia Tyson. It's actually her memoir. It's a New York Times bestseller. And Cecilia Tyson is a famous American actress. She died at age 96 in January 2021. And in her book, she talks about how she went to a health spa for a week where she was served only whole organic foods, all fruits and vegetables, and natural grains. And then this is what she says. When I went there, after a week of following that program, the world looked different to me. My head was clear. Colors, smells, and sounds felt more pronounced. My memory improved. I felt energized. She then went on to say she adopted that eating pattern for the next 40 years. And if anyone knows how she looked and how much energy she had, and she was acting well later well into her elderly years. So it worked for her, and it works for a lot of people. So healthy eating, right? Does that necessarily mean you can enjoy what you eat? No, that's not what we're talking about. But what we're talking about is it's important to know that there is an ideal eating pattern that has been scientifically proven, not only to prevent, but to reverse several chronic health conditions like diabetes, to reduce the risk of heart disease, cancers, Alzheimer's, and many other chronic conditions. And that eating pattern is the whole food plant-based diet. We're going to talk about this more, how it works shortly. But I just wanted to bring that up because there's so many conflicting and confusing messages out there about diets. And some people don't realize that by making dietary changes, they may be able to stop or reduce some of their medications, and that they can actually prevent serious health conditions, that food is truly medicine. That's good news, right? Especially if you have a chronic health condition, to know that if you're motivated enough, you can maybe reduce or stop taking some medicines, that you can feel better, you can have more energy, more mental clarity, you can lower anxiety. But don't go and empty your pantry quite yet, okay? This is something that cannot be done all at once for most people. And this is something that should be done with a healthcare professional, okay? So what is a whole food plant-based diet, and how can someone move towards it step by step? So a whole food plant-based diet is an eating pattern that emphasizes a variety of minimally processed vegetables, fruits, whole grains, beans, legumes, nuts, and seeds. Okay, so I'm going to break it down. First, the focus is on whole fruits and vegetables, and the idea is to eat a rainbow of color. So half the plate should be filled with whole fruits and vegetables, okay? And then you want to drink lots of water as well. You can also add herbs and spices, which help with antioxidants and flavor. Then next, you want to eat a variety of plant protein. Okay, so plant proteins like beans, peas, lentils, nuts, seeds. You want to incorporate that in your diet. And there are many seeds that are very easy to incorporate in smoothies, like chia seeds. There's goji berries, there's almonds, walnuts. You can put in oatmeal. There's so many ways to incorporate seeds, especially in your diet. And nuts. Then you want to choose whole grains. So for the other quarter of your plate, so the half of the plate is fruits and vegetables. Another quarter is plant protein. The last quarter, you want to choose whole grains. So brown rice, whole grain bread, whole flour, whole cereal, whole oats, can take the other quarter of your plate. So Cicely Tyson gave an example of what she ate, for example. So she said in the beginning of the day, she'll start out with a cup of fresh celery juice. And then she'll follow that with oatmeal and fruit. And then for lunch and dinner, she'll eat either like collard greens with yams or salad and lentils. So she later added fish and eggs to her diet. So she, that's an example of a whole food plant-based diet. Okay. So if you're currently on a whole food plant-based diet or along that continuum, share in the comments, how has it helped? This may just help somebody else, but go ahead and share in the comments if you're already doing this or you're working towards doing this and how it's changed, your health or just you in general. Unfortunately, though, most of the food we eat today is processed, right? It contains a high amount of fat and sugar, and the fat especially is very bad. Fat increases, we've seen an increase in chronic health conditions, not just in the US, but all over the world, as a lot of countries have adopted the Western diet. And fat in foods causes insulin resistance, which leads to diabetes. It also causes inflammation in the body, which causes a lot of chronic illnesses. So there are people, for example, millions of people, 88 million people actually have prediabetes. And prediabetes is one of those conditions that 15 to 30% of people with prediabetes in 5 years will develop diabetes if nothing is done. But that is an opportunity by eating healthy, going towards a whole food plant-based diet, that number can be 0. And that will be a great, great, great thing to happen if more and more people, by just changing diet, eating more whole food plant-based foods, you can actually reduce that risk significantly of developing diabetes. But before we talk about how to do this, what steps to take, I want to talk about 2 major barriers because sometimes some things stop us from doing what we already know, right? The first one is mindset, okay? And this is always the case with most goals. Having the right mindset is so important. So a lot of people, when they think of healthy food, they automatically think anything healthy doesn't taste good. If you go in with that mindset, okay, it's going to be much more difficult to accomplish your goal of eating healthier because your mindset about what you're eating makes all the difference, okay? So try to choose foods that you know that you enjoy, that helps, but also try to make an effort to think about healthy foods as good, not bad or bland, okay? So that does help when you change your mindset towards healthy things. It's kind of like exercise, right? The more you eat, the more you exercise, the better you feel over time. It's not right away. But the more you eat healthy foods, over time, you start to enjoy it. You start to, your taste buds actually change and you start to crave healthier things. So make an effort to change your mind about how you think about healthy foods. The other big barrier is cost. So many people assume that eating healthy will be too expensive. But I want you to consider the other costs, not eating healthy. So temporarily may not be that expensive, but what happens is the health cost of not eating healthy is so much greater. It's greater financially. It's also greater. The health cost of not eating healthy also affects many other things, your energy, your time, and so much more, your family, a lot of things. So yes, it is worth eating healthy. It's actually the most cost-effective way of taking care of your health is eating healthy. So if you're saying, okay, doc, I want to have more energy, I want to reduce or stop my medication soon, I want to reduce my risk of diabetes, heart disease, cancer. Where do I start? How do I start? So first of all, if you're taking medicine, please don't stop your medicine without talking to your doctor, okay? This is general information. You would need to have your own personal doctor talk to you about exactly how to go about it. If you are in the Houston area, if you don't have a doctor or you're looking for a doctor to help you with this change, to walk you through the steps, to support you through this journey, you can check us out at In Touch Primary Care. We are currently accepting new patients. We do things differently at In Touch Primary Care so we can serve our patients in the best possible way. So the way we're set up is very different from a lot of other clinics. But you can find out more about us on our website at www.intouchprimarycare.com. But regardless of where you are, the first thing I must emphasize is many people need to do it slowly, take baby steps. So some people can make a change all at once, but many people will need to do it over time. So how do you do this? The thing is, you can go as far along the continuum as you would like. The closer you are to fully adopting a whole food plant-based diet, the more of the benefits you'll see. But even incorporating just little things over time makes a significant difference. To do this, the first thing I would recommend is think about the change you'll like, okay? So make it something that you can measure easily, that you can do now, okay? So for example, you can say, I'm going to eat 2 pieces of fresh fruit for snack on weekdays, okay? So instead of getting your snack from a vending machine or some other unhealthy snack, you can make the decision to eat 2 pieces of snack on weekdays or fresh fruit for snack on weekdays. Or you can say, I'm going to add a green vegetable to dinner every weekday. So that's something measurable. Every weekday you can add on a green vegetable. You can do something like that. Or you can say, I'm going to cook dinner at home 2 times per week. Okay. So you can make something measurable, something simple, something that you can check in a month or so to see, am I really doing this? And something doable, something you know you can stick to. So once you've accomplished that goal, it's going to motivate you to do something new. So you keep building. So one step at a time. So go ahead and, make that decision today and start right away. Don't put it off. That really helps, okay? To be successful, though, it's important to plan, right? So if you have decided, for example, you're going to eat fruit every day, it's important to plan ahead of time. So you want to make sure you have enough fresh fruit at home. You have a variety of the fresh fruit that you would like. You want to make sure that if you plan to take it to work, that there's actually a place to put it at work. If you usually get your snack from the vending machine, you may want to think about a different route to your office so that you avoid the temptation. But the idea is just plan as much as you can so that you can be successful. And try to stick to that same plan consistently for at least a month. You can do it ideally 2 to 3 months, but you want to do at least a month consistently of whatever you choose, and then before moving on to the next thing, okay? And then the third thing in terms of being successful, so first thing, you want to pick something that you can measure. Second thing, you want to plan. The third thing is you want to prepare for setbacks. So it's summertime, you're going on vacation. That's a trigger for a lot of people, right? So you want to think ahead about that. What am I going to do during the vacation that will make it easier for me to continue to eat my vegetables? Do I need to find, do I need to make sure I go to restaurants that will have that option? Do I need to, take anything along with me? You just need to plan. If you know it's a change of schedule that is going to make you have a setback, you want to plan ahead of time. A lot of times, a lot of us use our kids as excuses, right? The kids want something, sweet or whatever, and so we join them. But the truth is the kids can start eating healthy too. We don't have to buy a whole bunch of snacks for the kids and then eat them all. We don't have to buy it. If it's at home, if it's not there, then the chances that we eat it will be a lot less, right? So if you use your kids as an excuse, this is a good time to stop using that excuse. But if they're old enough, they're getting their own stuff now, one thing to do, you can plan ahead by getting your own substitute. So if every day, if you know they're going to have ice cream or they're going to have cookies, get your own snack, or don't be there when they're eating so that you're not tempted to join in. But the idea is prepare ahead of time, know your triggers so that you can be ready when those triggers present themselves. So if you made a decision today, go ahead and put in the comments what you decided. And, if you're already doing this, go ahead and put in the comments what you're doing, and so that maybe it can help somebody else. So the point is, dietary change is key, and it's actually the most cost-effective way to stay healthy and to be healthy. The benefits of dietary change are way magnified when you add exercise, stress reduction, and when you improve your sleep. But even with just dietary changes, you can make significant changes to your health. So go as far along that spectrum of whole food plant-based as you like. The closer you are to fully adopting it, the more benefit you'll get. You can take steps over time, and regardless, you start to feel better, you're going to get healthier. You may actually reduce or even stop taking your medication, which also further lowers your costs. You save, you have more energy, you have mental clarity, you lower anxiety, you reduce your risk of heart disease, cancer, diabetes, Alzheimer's, many other chronic conditions. So it's certainly worth the try. So if you're in Houston or in the surrounding area and you want to work with us, as I said, you can check us out, www.intouchprimarycare.com. But regardless of where you are, remember, follow up with one doctor consistently who can help you connect the dots. So please leave your comments. Let me know what you think. Let me know if you made any changes. And that's all we have this week. So join us every week, same time. It's at 2:15 typically, okay? So 2:15 on Facebook Live. If you're not able to make it at that time, you can share, you can join us on the In Touch YouTube channel and subscribe. Feel free to share with as many people as you think might need it. Bye-bye. See you next week.